Hi, it's Dr. Latness again. Today is March 18th. It's towards the end of the day, and so most of the data is in and you guys are packing in for the night. My message today is really a message of hope. What I'm going to do is I'm going to cover some brief medical things you need to understand about the coronavirus situation. And then I'm going to talk a little bit about what we're going to start seeing regarding the economic and the financial, and why it's important that you understand these, because these are still going to impact the medical part of things. There's a lot of smart people working really hard. I've been very pleased at all levels of responses, from the federal government to our local hospitals and our communities. It's really been great, and we're going to continue to get better. I know it's a scary time. A couple of things that you're going to start noticing. We're all going to get tired of hearing new data about new cases popping up here and there, and who's getting it, and all that's coming out in the news. And that we're going to get fatigued with that, and that's going to make our guard down on what we should still continue to be focusing on, and that's still the social distancing. If you want to understand more about what to do when you get sick, I want you to go watch my previous video. That's all still the same. If those of you are interested in really the numbers of this, and you're like me and you need to understand what's going on locally and in the world, there's going to be a link at the bottom of the page that'll take you to a place where I'm getting my information. There's a concept that measures really where we are on the curve of the number of cases going on up. And the concept is that every country has a number of days until they double the number of their new cases. And basically what this reflects is how steep this curve is. So if in Italy right now, they're still at 4 days to double their cases, which means they're still on a graph like this. In the United States, we've actually made a lot of progress. We've gone from 4 to 5 days, which means we're still on this progress, which means we still need to work really hard to continue this social distancing. It's really important. Some of the successful countries, again, that I mentioned earlier, including South Korea and Singapore, their days are more like 8 to 10 to 15. And that's because from the beginning, they've been able to pace this out very well. And then finally, you'll look on those charts and you'll say, well, China's at 30 days. Does that mean what's going on there? Well, that basically means they've already passed their peak and there's not as many people getting it. And that's great news for them. So my medical message today is very simple. Keep up social distancing as much as possible. Think about this like you're holding your breath. Hold your breath as long as possible, and then every once in a while, get outside and go for a walk, go for a drive. You don't have to stay indoors. In fact, it's more healthy for you to get out every once in a while. You just really want to stay out of social interactions in public. You're still going to need to go to the grocery stores, and the grocery stores are going to catch up, and they're continuing to do an awesome job of figuring out how to get groceries to you without having you go in there. So look for things like picking up at the curb or having delivery. They're going to get better at this, and they're working really hard. Your food retailers are doing an amazing job. They were scared because they were getting shut down, but they figured it out like this, and now they're delivering, so take advantage of that. Support them in the local economy. I have the same message to you as to when you need to go get testing. Yesterday, our government sent out a message that for those 65 and over, if you have a fever of 99.6, then it's time to go get tested. Now, ideally, we still need to assume we're going to have drive-through tests up and running as soon as possible. I think we're really close. And when those are available, go there. Get tested, and then they'll send you home unless you need to come into the hospital. And they'll help you make that decision. On a note to that, your question may be, well, if I'm sick and everybody's going to get sick, why do I really need to get tested in the first place? Well, there's two reasons for that. One is because we need as much data from a county and a local statistical basis as possible, so we understand where the virus is and how fast it's spreading. And that's going to help us get the message to you as to what to do from a community standpoint. Second, if you test positive, you're probably not going to be able to go to work or do anything until you test negative again. And that's really important for you to understand. Nobody's talking about that yet, but we got to think though, if we get sick, we're going to be out of work for a couple weeks, and you're going to have to show your boss what you need to know to go back to work. And it's probably going to be a negative test. Okay, so count on that. That's why we need to know when you were sick and when you get healthy again. The next thing I want to talk about is the fact that we're shifting from a medical problem to a social problem and a financial problem. Whether you guys have talked about it or not, I know everybody's stressed about their jobs. You're stressed about not making any money and whether you're going to be able to pay your mortgage and your credit card and other expenses. That's on everybody's mind. And I really understand that. And that stress level is going to affect your health, but it's also going to drive you to make bad decisions. For example, if you feel like you still need to go to work because you need a paycheck because you're not going to be able to pay your rent, then you're not only doing yourself harm, you're doing our whole community a harm. And we're going to need each other to get sick slow for our community to recover faster. So realize the financial impact is going to hit us all. We need to accept that. And what's about to happen is really one of the most beautiful social things that our country's ever seen. We need to start thinking about how this is going to affect not us, but how it's going to affect everybody else. So the next thing that I want you to think about is the social impact on you. I know you're sitting at home and it's really hard not to think about how this is impacting you, but realize we're all being impacted by this in a big way. So I want you to start thinking about how you can help other people out. And that means how you can help out checking on the neighbor down the street who doesn't have any family in town. That means how can you promise your friend that if they need to borrow a little bit of money to make sure they can pay their bills next month, you're okay lending them that money. If you're the person that needs the money, then you need to be able to have your network set up to say, hey guys, I need some help. And I guarantee you we're all going to be there to help you. And that's the beautiful part about this, is we just got to count on each other. We have to have faith that once this whole epidemic is over, that we're all going to recover in a big way. The final point I want to make is the financial aspects of this. In my worldview, this curve not only applies to the virus and the surge on our healthcare system, but it actually also applies to the financial system as well. If everything goes bad at once, then we're going to be in a real bad financial stress situation. I think the way we can help this is to count on the really smart people in government and private industry, the local businesses. We need to keep them all going. We need to have our lawns mowed by the people that mow our lawns. You need to mow somebody's lawn to make some money too. So realize you guys sitting at home is part of the problem just as much as it is part of the solution. So think about a way that you can keep as much money flowing through our economy as possible. Because if people are stressed about their money, they're going to work, and when they go to work, they're spreading the virus. So we need to shut everything down. We need to trust that we're going to be taken care of financially and socially, and you guys need to be a solution to that problem. I know it's very difficult to understand the concept of the ability to help somebody out when we're all going to have less. But I really think if we get past that and we think, man, what a great world this is going to be when we see each other help each other out and we get through this, we're going to have a beautiful recovery. The economy's going to come back. We're going to go back to work, and we're going to say 2020 was a weird year, and it was a crisis from a health standpoint. It was tragic, and then we're going to realize that humanity is really a beautiful thing. And that's the message I want you to hear from me today.